Hey everyone, Coach DJ back. I'm taking another hike through a green space. If I'm looking down a lot, it's because it's a little bit treacherous back here, but it's absolutely beautiful. And I wanted to share something that I have been thinking about all morning, and it's from the book of Romans, and it's Romans 7:15, where Paul says, "For I do not understand the things I do the things I don't want to do, and I don't do the things I want to do, or I do the things I hate." And how relevant that is for the health community. And um, it just makes me wonder why, even though sometimes we know what we're supposed to do for our health, um, we don't think we have the time, or we don't want to make the time, or maybe sometimes we aren't sure where to start. Sometimes it's just easier to go to the doctor and get a prescription to mask the symptoms, but never really get at the root cause. And one of the key things about the proper human diet community, from which I am certified as a coach, um, we know that food is medicine, and there are lifestyle. I'm just looking where I should go here. I guess I'll go this way. Um, Things like getting out in nature, getting out in sun, um, exercise, doing things to relieve stress. Um, Yet we don't do them. We have the symptoms. Um, I was looking at some of the statistics today on obesity, for example, particularly um, those with midsection obesity, and how much higher a risk they have for things like diabetes and heart disease. And, yet still probably consuming uh, foods that are not single ingredient, um, highly nutritious foods, and probably many still consuming way too many carbs and processed foods and sugars, and also feeding those things to their kids. And their kids, aren't learning. So I just want to speak to all of us who know that we can do better in um, trying to improve our health and teach our kids and our friends and our community that we can change our health. We can improve our blood markers. We can reverse diabetes. One of the things that I was very surprised about by going to a very meat heavy, very low carb and high fat diet is I reversed carotid artery disease. My carotids were really blocked. I would say that the test that I had was the first test I had was about 5 years ago. And then I had another one about 3 years ago. And there was a remarkable difference. And probably the traditional medical community would have said that never would have happened from, a high fat, high protein diet. Um, so I just want to encourage people that if you need help, um, or even just a little bit of guidance and direction, reach out and let's have a quick conversation. See if you'd like to just have a quick discussion, or maybe you're ready to step into, hey, I do need a little guidance for my journey to get me started in the right direction. Um, my colleagues and I have a number of different specialties. So if it's not something I can help you with, then most certainly one of my colleagues in the PhD coaching community most certainly can. So just wanted to get that message out, and no, I'm going to keep walking and try not to fall. It's absolutely beautiful here. It's nice and cool, little breaks of sun through the trees, and just really enjoying myself, and just wanted to say hello. So God bless you all, and leave me a comment if you want to chat.